and not the person responsible. This is funny if it wasn't so serious. The minister responsible is not happy and will get involved if it doesn't get better in the coming years. An editorial in the Irish Examiner sums it up. The HSE's credibility is at a very low level. Story after story of treatment denied or delayed, of dire predictions realised, all met with nothing more than a promise of reform. The situation is simple enough. We do not have an acceptable health service, and those charged with managing it, ministers or officials, seem to live in a parallel universe where the urgency, imagination and determination needed to confront the issues seem absent. Minister, there is not one nurse in this room who would disagree with this assessment. Budget before patient. What cost to our nation's health? This is government ideology gone mad. Minister, this has been a very critical address, but it is my job to get it across to you the anger, frustration and demoralisation felt by our members, both about the manner in which nurses are being treated and also the lack of services and resources to maintain, never mind develop, adequate services for those suffering mental ill health and for those with intellectual disability. I do, however, wish to end on a positive note and to acknowledge your support and your department's support for our upcoming professional conference in Dublin Castle on September the 1st. The purpose of this conference, in cooperation and consultation with the other stakeholders, the Department of Health and Children, the HSE, the Health Service National Partnership Forum and Horatio, who are the representative organisation for European psychiatric nurses, is to identify areas of excellence and best practice across the country and to highlight them for the purposes of mainstreaming. It is our hope that the conference will help in having these advances available to patients countrywide and not confined to local services. The benefits for patients and clients would be immense. Minister, we look forward to your continued support for this project. This is a wonderful example of health service partnership in action. I would like to acknowledge the hard work and commitment of the outgoing officer board, and in particular those who are leaving us. Jerry Cunningham, and that soft Cavan accent which hit a very tough negotiator. Paddy Craven. Paddy Craven and his very forthright and honest contributions. We will miss you, Paddy. John Murray and his common sense. He is now the elected Vice President of the Nursing Board on Bord Altronish. Well done, John. Mary Conneely, who most certainly brought some glamour to the officer board. But most of all, she brought a great passion for the ID sector in particular and did Trojan work. Good luck with your studies, Mary. Des, in his address yesterday, paid tribute to friends and colleagues who have passed in his report. And however weak the PNA were up there, the ITGWU now have serious concerns. Our full-time staff had a huge year between moving office twice, a national nursing dispute, the compensation scheme, and I just say well done to all. Without the voluntary effort of all branch officers, all full-time nurses, none of it would be possible. We thank you. Also, your partner support is appreciated, and my own Mary is down there, I think, take a bow. Our members, their partners or spouses who are ill at present, the PNA wish them all a full recovery. Busy as Des Cavan is, he still found time to be part of a European movement called Horatio, with a potential to represent upwards of 500,000 psychiatric and mental health workers. There are already 15 countries on board, and they have their first European conference on the 5th to the 9th of November in Malta. And to give you a flavour of the board, the General Secretary is from the Netherlands, The Treasurer is Swedish. The Vice Secretary is from Holland. The Independent Advisor is from the UK. And there are 5 ordinary board members, 1 from Finland, 1 from the Czech Republic, 1 from Germany, 1 from Malta, and 1 from Cyprus. And Des Kavanagh is the president of that movement. And on your behalf and my own, I wish him and his team every success with the conference. And I'll just finish by saying what Hamlet said to Horatio also applies to Des Kavanagh. You're as steady a man as I have ever talked to. Thank you.